5 minutes of that.
Okay. All right. Well, good afternoon and welcome to the MDDC Medicaid Education, Advocacy, and Information Session. We appreciate your prioritizing your precious time to be here today. My name is Gyasi Burks-Abbott, and I am a citizen member of the MDDC and serve as a chairperson of the Policy Committee. And now I would like my colleagues Jennifer, Kaitlin, and Joshua to introduce themselves.
Hi, everybody. I'm Jennifer Bertrand, Deputy Director here at the Massachusetts Developmental Disabilities Council.
Hi, everyone. My name is Josh Gladstone. I am the Disability Policy Specialist at the MDDC.
I'm not sure.
Yes. I'm Kaitlin, and I'm a Disability Policy Assistant also with the Massachusetts Developmental Disabilities Council Policy Team.
Well, thank you. This information session today will be recorded, and we will email attendees tomorrow and share a link to the video recording, the slide deck, and the MDDC link to share your Medicaid stories. Please stay muted during the session. We will take questions during the presentation from attendees as time allows. If you have a question, raise your hand or enter it into the chat. Jennifer, Joshua, Kaitlin, or I will call on you. We have a fair amount of content to cover today. Our team will plan to stay on the Zoom after the presentation and to allow time for more questions. Next slide. Now to review the agenda. Okay, I just gave you the welcome. So we're going to be talking about Medicaid, what Medicaid is, how does Medicaid help people live their lives, what could Medicaid changes mean for our community, and what you can do. I'll hand it over to you.
Jennifer, I think you're muted.
Thank you, Josh. Why are we here today and why are we talking about Medicaid? As you may be aware, Medicaid is a lifeline for people with disabilities. And right now, federal lawmakers, people in government, and the new administration are looking at cutting costs by possibly cutting Medicaid funding. Education and advocacy are really important. They're needed to help inform lawmakers, people with disabilities, and the greater public about why Medicaid matters to our community.
And so we wanted to start by talking about what Medicaid is. Medicaid's a public program that provides healthcare through health insurance and also long-term services and supports for folks. It's actually one of the only ways that people can get long-term services and supports. Medicaid is funded by the federal government and by the states. So they both provide money so these services can go to residents across the country. Medicaid serves eligible people with disabilities, people who don't make a lot of money, children, and older adults. These are some examples of the populations that Medicaid serves. And Medicaid programs are different in every state. So that means the eligibility or who can use Medicaid in each state is different. And also the types of programs or services and supports that Medicaid provides is different from state to state too. More than 2/3 of the Medicaid long-term services and supports are delivered in home and community-based settings. So this is when people live in the community in their own home, in a family home, maybe with some roommates. The remainder of Medicaid long-term services and supports are provided in institutional settings like nursing homes or congregate care settings. And so Medicaid provides health care, like going to the doctor or getting certain medicines, but it also provides these home and community-based services so people can live their lives in the community. And these are some example of Medicaid services that people use. So first, Medicaid can provide funding for direct support professionals and personal care attendants. These professionals assist people with everyday activities they need to live their lives. Medicaid can also support employment services like job coaching or supported employment. Things like home modifications, like building ramps or door widenings, as well as assistive technologies. And these can be mobility devices, but also things that help people communicate, like augmentative and alternative communication or AAC devices. Medicaid also supports family caregivers of people with disabilities, and there's a variety of programs that do this. One example is respite. Medicaid also can provide payment and funding for certain services in schools for people to support the learning of people. So this might be like some targeted therapies people get, like occupational therapies, physical therapy, some speech therapies, as well as behavioral supports in school settings. The last example that we're providing is accessible transportation to and from medical appointments. So this can also be a service that Medicaid provides. And thank you, Chris. I see that you wrote Medicaid is called Mass Health in Massachusetts. That's a really important point that we talk about a little bit. So if you're wondering, do I use Medicaid? Mass Health is what Medicaid's called in our state. Thank you.
I think it's important to sort of get a little bit of a larger picture of Medicaid services. There are two main categories. There are these mandatory services under Medicaid where, states are required to pay for these services. And again, remember, Medicaid is a state and federal partnership to provide these services. And then there are the things that we talk about that are considered non-mandatory. Let's take a look at some examples of mandatory services. These are Medicaid services, again, that states have to provide for eligible recipients. They could look like things, maybe a doctor's visit, medical care in hospital, long-term supports and services provided in a nursing home or an institutional setting. Then there are non-mandatory services. It could include things like dental care, certain medicines and therapies. The home and community-based services, those long-term supports and services that some people with developmental and other disabilities receive, those are optional services. They are mostly provided through waiver programs. So states have, certain decisions about their budgets and developing their state budgets. They have to provide those mandatory services, but not necessarily the non-mandatory services. One thing I'd like to point out is that there's been a court decision that's really important. It's called the Olmstead decision, that the courts affirmed people with disabilities' right to live in an integrated setting within certain limits. And then we've had some rules that have come out. Back in 2014, we had the HCBS settings rule that also talked about how people with disabilities should be allowed to live in those integrated settings. And then more recently, we had help me out here, Kaitlin.
HCBS access rule.
The access rule, which also then reaffirmed that. So there's some tension and differences about, we have the two categories, mandatory versus non-mandatory, but then we have these other important rules that have come forward, and they are saying, hey, people do have a right. So certainly those are things to be informed about, because there are things that you can use to help advocate for services that you need to live in the most integrated setting.
Now, in terms of mandatory and non-mandatory, someone put in the chat that the non-mandatory should not be really considered optional. They are needed, but the funding is discretional.
That's a really good way to describe it. I'm not sure who put that in the chat. I'm not saying that they're not needed. I'm just saying that, the federal government, if they're going to pay a portion of the state's Medicaid program, states have to provide certain things, but not other things. But we do also have these court decisions and the HCBS settings rule and the access rule that have really gone on to say that, hey, wait a second, people do have the right to live in the most integrated setting. We just haven't changed that on the federal level. This map that you see before you right now shows Medicaid expansion. This is another part. We've talked a little bit about home and community-based services, and long-term supports and services. But there's also the Medicaid expansion that was done back in 2014 as part of the Affordable Care Act. States can choose to opt into the Medicaid expansion, and there are 41 states, including DC, that have done that. The link here, when we share out the slide deck, you can click on it to see a larger picture of that map and information about the status of states relative to the Medicaid expansions and which ones are participating. The important thing here is that Medicaid expansion helps cover important medical services to people with disabilities, especially those that might not be receiving long-term supports and services, be eligible for other reasons, maybe because it's how much they're earning, that type of thing. But we also wanted you to be aware that Medicaid expansion is part of that large umbrella of Medicaid services.
And David Hoff just put in a chat about the Medicaid waiver services. I don't know if we want to capture that.
Yeah, go ahead. Can you read his?
Yeah, he just put in information about Medicaid service. I'm saying, can we
Oh,
capture that?
he put a link.
Yeah.
Put a link,
So
yeah.
it's a link. So thank you so much, David, because people might be wondering what services are funded by Mass Health or Medicaid. And because Massachusetts waiver programs or services are different than other states, you might want to see the list of things that are provided there. So that's a really great resource that people can check out.
That's fabulous. I want to save that link as well, Kaitlin. So Medicaid expansion, more on that. So the federal government pays most of the funding for people who are covered under Medicaid expansion. And it also helps, obviously, like I just mentioned, people with disabilities to get the care they need. And then this little infographic down there shows you about the state federal share in paying for these Medicaid services. Traditional Medicaid, there's that 50-50 share between the state and the federal government. And with Medicaid expansion, the federal government was paying about 90% of that share to make it more affordable for states to be able to offer that Medicaid expansion and include more adults that fit their eligibility criteria, or the things that people, trying to think of how to say that in a more plain language way. Kaitlin, do you want to help me out?
Absolutely. I'm sorry, because I'm also looking at the chat and reading the great questions. Could we go back to one slide? So when we're talking about Medicaid expansion, this is a population of people who weren't previously eligible or able to get Medicaid. And now when states choose to expand, some of them did this. It was first an option in 2014, and about 25 of our states did it at that point in time between 2014 and 2016, and now more have. We see over 41, about 41 states have chosen to expand. So this just expanded who could get Medicaid. Sorry, Jennifer, did you have a specific thing you wanted me to talk to more?
No, I think the way that you explain that is really helpful and makes it more clear that this allowed access to more people with disabilities who might not qualify for the traditional home and community-based services and long-term supports and services.
Yes, absolutely. So I think that, Joan, you asked what Medicaid expansion does. So a lot of people, even if they had disabilities, and you say, well, why weren't they getting Medicaid beforehand? With Medicaid expansion, a lot of adults with disabilities were able to access Medicaid more quickly and with a more kind of easy process to be approved so that they can get the services they need quicker rather than waiting really long periods of time to be approved.
So
We also have a question from Diane that says, is this 50% share different than what we hear DDS getting back for some services?
I would have to take a look at that question and get back to you on that, but I will follow up in an email to you. Moving right along. So essentially, we have these under Medicaid, there are these long-term supports and services, these home and community-based services that are important to people with developmental and other and other disabilities. But then there's that Medicaid expansion that broadened the group of people who could participate in Medicaid and be covered and receive the medical care that they need to stay healthy and be productive citizens. Now, here's a slide about Medicaid in Massachusetts, and I know, Kaitlin, you were planning on speaking to this one.
Yeah, and it was good that we brought it up earlier, but we wanted to point out that in Massachusetts, our Medicaid program is called Mass Health. So you might think about services that that Mass Health provides to people, to yourself or people in your family. And there are about 1.7 million people enrolled in Medicaid in Massachusetts. So this is a really substantial sum of our population. It's almost about 25%, I think. And we have a little graph here that shows these different population groups, who's getting coverage from Medicaid. So we see 2 in 9 adults, who are under the age of 64, 1 in 3 children, 3 in 5 residents of nursing homes, 1 in 4 Medicare beneficiaries. So Medicare is another program provided by the federal government. People who are in both Medicaid and Medicare are sometimes called dual eligibles, if you've heard that phrase before. And then we see that 4 of 9 people with disabilities are being covered by Medicaid currently in our state.
Are there any other questions before I move on, Kaitlin or Josh?
So I see some questions around, will the community-based waivers still exist? And what are examples of home and community services? So Joan, I know you joined us a little bit late. We do have a slide that gave some examples of home and community-based services like personal care attendance, transportation. We'll make sure that we get this slide to you. And we can go through them more with you after in our question Q&A period too, if we have time. Does that sound okay, Jennifer?
Yep.
And then Fran had a question about, will the community-based waiver still exist? We are actually going to talk in a few slides about what changes are people talking about in regards to Medicaid. What are people saying might happen? And so we'll get into that a little bit more then. The quick answer is that it's possible we might see some waiver programs affected if the federal government changes how they are willing to support states in funding Medicaid. So that's a spoiler, but we can get to our next slide where Josh is going to talk about how Medicaid helps, people in our community live our lives.
Yeah, hi everyone. So this has been so much amazing information, but I know for me that sometimes when I see all the information in the numbers, that doesn't connect for me the same way that really seeing a story does. So here are a couple of examples of some stories of people in our community where them live their lives meaningfully. So first we have Cody, who is our vice chair of our council at the MDDC and a college student at UMass Boston. And I think Cody does a really good job sharing how PCA is one of those things that is provided by Medicaid, really helps him, go through everyday tasks, whether it's, getting his nails cut, whether it's going to and from class, whether it's having food be prepared for him. And just like everyone else, Cody deserves to be able to have these things available to him so that he can live that meaningful life. So next slide, please, Jennifer.
And Josh, Tamara is on the Zoom today as well.
Amazing. Well, I want to give a special shout out then to Tamara, who has been with the MDDC as a self-advocacy liaison for over a decade. And Tamara, if you want, we would love for you to be able to, share, but also I'm happy to read off if you're comfortable with that. I can continue, and Tamara, please interrupt me. But so Tamara has been on our awesome training team, and I think Tamara, similar to Cody, does a really good job talking about how Medicaid helps Tamara live this amazing life. And thank you, Cody, that it was UMass Amherst, not UMass Boston, for the correction of where Cody's going to school. But Tamara talks about having PCAs that help her do everyday tasks. It is having medical equipment like wheelchairs that help Tamara get around. And these are the things that help Tamara and Cody with the PCAs to have those meaningful lives. And that is due to Medicaid. Then next slide, please. So the last little story that we've embedded in our slides is
Josh,
Craig Howell.
Sandy's also on the Zoom today.
Amazing. Well, hello, Sandy. I'm really looking forward to getting to meet you. And please interrupt if there's anything that you want to add. But as we can see here, Craig is a fantastic, talented photographer who is published out there. And It's also working at Market Basket. And I think Craig does a perfect job in encapsulating why Medicaid is so important. And Craig says that Medicaid is important to him because he wants to live like everyone else. And that means working, it means voting, it means living in the community. And that is the same thing that everyone deserves. And I think that these are the stories that really, put why Medicaid is so important into perspective. And I will pass it along.
Sandy, did you have anything else to add?
Again, I want to really say thank you for having this informational session on Medicaid and how important it is to each and every person here in the Commonwealth with disabilities. Craig is one example, Cody and Tara as well. It really matters for Craig. He does receive home and community-based waiver services. He has individual support hours through the Department of Developmental Services, paid through Mass Health, Medicaid. He has supported employment, job coaching. He has PCA hours. And he also relies on Medicaid as a secondary insurance for a lot of his significant medical needs he's had over the years. And he, does just want to live like everyone else. He lives with a roommate in a small little town in Fairhaven. And without this support of Medicaid, he would not be able to succeed. He also receives Section 8 and food stamps that can make a huge difference for any person on a limited income. As we know, SSI, Supplemental Security Income, is not a high amount of funding. And he does work. He's very proud of that. And he is a photographer, but we do know that many people here in the state of Massachusetts and around the country with a disability live in poverty as well.
Thank you so much, Sandy. Cody, I see you on the Zoom as well. Did you want to mention anything about your slide?
Just we are in scary times right now, and with a lot of people are independent. There's a stake I will share. I'm in the process of hiring a new PCA, and while I'm doing just fine, my rules not getting clean, and with a dorm is like the PCA.
Cody, it sounds, oh, excuse me.
When I move out, I could get charged for massive force and all that. So, I don't see that happening. I've seen myself have it on.
I'm glad to hear that you are in the process of looking for and hiring a new PCA. These are serious times, but this is why we're having this session today, to learn more about Medicaid and make sure individuals with developmental and other disabilities understand all of the different ways that Medicaid is important to their lives. Sometimes you might think Mass Health is the entity, and yes, while that is how Medicaid is administered here in Massachusetts, it's that Medicaid funding and Medicaid services that are important. We're going to move right along because we have a lot of content. And while, these are serious times and talk is happening about cutting costs in government, we've come together today so that we can help provide information and ways that you can help educate our elected officials and help them to make more informed decisions. Thank you, Tamara. Sandy and Cody. So what could changes to Medicaid mean? Right now, we already know that there are many people waiting for Medicaid services in Massachusetts. And if there are more cuts to Medicaid on the federal level, it could make it more difficult for states to be able to afford or provide those services. There's only a limited amount of resources available. We're in the state budget process right now, trying to decide, what to prioritize. So funding cuts on the federal level would definitely impact states' ability to fund services on the state level. Some non-mandatory programs like the HCBS waivers could receive less funding, and that could mean that there are longer wait times for services, maybe fewer direct care workers, or maybe direct care workers leaving the field because they're looking for more secure employment. Without supports, people might be at higher risk for living in institutions, and we don't want to see that happen. I don't want to panic anyone. Nothing has been decided today, but I think, and my colleagues would agree, and of course our council members and Gyasi as our policy chairperson knows how important it is just to keep everybody informed, to know what's happening. We will continue to share information about what's being discussed and proposed. I included this slide. I know it's a little bit complicated, but I included this slide because it really shows that if the federal government decided to cap or like block grant Medicaid, a per capita cap would limit spending each year, and that would have a greater effect as each year progresses. So these cuts would increase over time. Even a proposal that maybe had a modest cut beginning year one, in the initial years, it produces larger and larger impacts over time, because the funding would not keep pace with the actual cost, healthcare costs. So you can see in this graph that yellow arc that is going downward can show that cumulative impact if funding on the federal level was cut to be less than the actual costs year to year for Medicaid services. So again, nothing's happened. This is just a projection. This is just a scenario. Like if we had per capita caps over time, you can see how the effects become, they increase over time and are ever growing. We have all of our sources cited, by the way, in the slide deck with some hyperlinks. There's a resources slide at the very end for you to reference any of the information and data that we've shared here today. All right.
The only thing I wanted to, sorry, Jennifer, if I could jump in on the last side. The only thing I want to add is that if Medicaid funding is cut, if the federal government doesn't provide as much funding as it currently is to help states, it's going to have a negative impact on everyone. However, when we look at this graph, this is really scary and concerning for people with disabilities specifically, because one of the ways that states would try and balance their budgets and make up for that gap in funding is by cutting programs that are the most expensive, so for some more specialized services and smaller populations. And we know that this would affect folks in our disability community specifically. So I think that this graph really does a good job of showing, like, this is going to be hard for everyone, but understanding it's especially hard for a lot of Medicaid beneficiaries with disabilities specifically.
And remember how we talked about mandatory services versus non-mandatory services. If they have to make cuts, those cuts would more likely impact the non-mandatory services like the home and community-based services, because states are required to provide those institutionalized services like in nursing homes. So this is why, it has the potential to drive people, into an institutionalized setting if they have no other options available to them. This is not happening right now. No decisions have been made. This is just a hypothetical case of, if they were to decide to do per capita caps, what would that look like and what would the impact be? And this analysis was provided by the Center on Budget and Policy Priorities at cbpp.org. And again, it's cited in the PowerPoint slide, and you can go to the resource to learn more about impacts of a potential per capita cap. All right, Josh, it's your up.
Amazing. Well, first, I know that some people joined later, so I want to again affirm to everyone that we will be sending out the slides and the recording after the completion of the webinar. So all of these links that we have embedded with all of the resources, you will be able to click on them, be able to reference and explore the content yourself. So don't worry if you're joining late. But I'm going to start referencing something that Jennifer talked about earlier, where it's really what's going on. So there are advocates that are already making their voices heard when we have these scary things that are going on. So on February 6th, the National Association of Councils on Developmental Disabilities, the NACDD, had this big effort where they had advocates from all across the country call in at the same time from this hotline, so that representatives and legislators in DC and on Capitol Hill really were forced to hear what was going on. There was attention drawn to the issue, and it really, put a limelight on why this is important for so many people. And this was just accomplished in a singular day. And one of the beautiful things about the disability community is that we are coalition building and that there's a lot more that we can do.
Excellent.
If you could go to the next slide, Jennifer. Thank you. So speaking of what we can do, we really want to hear your voices and your stories. And we really talked about the power of stories earlier. So at the MDDC, we really want to hear your Medicaid story. So we have created this resource with this survey, and we'll drop the link into the chat. And of course, we'll be sending it out afterwards, and Jennifer will click on it so we can explore this together, where we really break up what it would be to create your Medicaid story and why that's so important. And if at any point when you're looking at this resource, if you have questions, there are the emails of the contact information of both Kaitlin. Love to schedule a time to help walk you through this resource. Thank you, Jackson, for dropping that in the chat. And Jennifer, if you could pull it up, that would be great.
Sure. 1 second. Go into the chat. Thank you, Jackson. And I'm going to share my screen again.
Perfect.
It says that I've already taken the survey, so I can't walk you through it. Josh, will you click on the link?
Yes, let me see if I can get this up. Sorry, everyone. Stick with us here.
And then you can share your screen.
Perfect. Okay.
I've gone in a couple of times just to test it and then get feedback from our staff and other council members. So that's why it's telling me you've already done this.
Okay, great. Can everyone see my screen?
So when you click that link that Jackson Crilly dropped into the chat, the Medicaid Story Collection, it'll take you to this platform. And this is a platform that you can respond to the prompts and share information about why Medicaid matters to you and how it makes a difference in your life. So look like this. Can you just put test in there, Josh? Thanks.
Absolutely.
So it'll ask for your first and last name and what state you live in. And then you check off all that apply to you. If you're a person with disability or a family member, professional or other, you can fill that in. Next, and then click the next button. And then you can share your story. So the MDDC is here to provide assistance. If you need help answering the questions, you have Joshua and Kaitlin's contact email information there. So if you need some assistance to be able to complete this, we are also there to help you. Question number 4, select the ways in which Medicaid helps you. Some of you had asked earlier, like, can you give me some examples about how Medicaid helps? Well, here are some different things: to be able to live and engage in the community, have that medical and health insurance so you can be healthy and productive citizens, and to get help and support maybe with your activities of daily living, like bathing, dressing, and eating. Finding and maintaining work. Supported employment is really important for individuals with intellectual and developmental disabilities. They're the most underemployed and unemployed people in our society today. So Medicaid funding provides that supported work so they can enjoy the dignity of work and have more meaning in their life. Support to succeed in school and so forth. And then you could add another to specify if you would like. And then here we're asking you to help share your story in your own words. You just follow the prompts below. Here's what my life looks like now. So you could say something like, I live in my home in the community, not an institution. I work, I volunteer, whatever pertains to you. And again, if you need help, please reach out to Joshua or Kaitlin or myself. We're happy to help you craft your story. How Medicaid helps me live my life. So you could say something like, I need a caregiver to be able to get out of bed in the morning and go to work, to help take my medications, to get to appointments or other places. And then question 7 is about, if Medicaid is cut, I will not have the basic support to, and think about maybe some of the examples that Sandy gave about her son Craig earlier, or Cody shared on his slide about important Medicaid services that help him to continue to be a student and transition into his adult life. Or even Tamara, who is an adult, who has a career, but her essential Medicaid services are really what makes it possible for her to be as independent as possible and have the same opportunities as any other American. And then number 8 is a share. Oh, I think we went beyond that. Number 8, you can upload a picture of you at home in the community, working, volunteering, participating in community recreation, things that show, you being a productive citizen and a member of the community. You don't have to, that's not required, but a picture is worth 1,000 words, and it helps put a face to this issue. Instead of looking at it as mere budget line items, it will help our lawmakers be reminded of the people and who we are as people who are important members of the society as anyone else is. So the next. Number 9, I give permission to share my story with legislators. This includes using a photo if you uploaded one. Number 10, I give the MDDC permission to use my story for public awareness campaigns about the importance of Medicaid, and they may appear on social media, email, newsletters, or so forth, so you have the option to agree or not agree. Next. And then thank you for sharing your story for us. You clicked done. We plan to put together some resource documents to share with the Massachusetts delegates, that they can use these stories when there are discussions in Washington, D.C. about federal Medicaid budget and funding. They can use the stories to talk about the people, to remind elected officials about their responsibilities and how Medicaid helps people with disabilities live meaningful, productive lives. So we encourage everyone to please share a story so that they can use this information to, have these budget discussions and change hearts and minds of our federal lawmakers. Let's see. Back to the slide deck.
Jennifer, I'm seeing a question in the chat from Jessica that says, is there a deadline for the survey or for sharing our stories?
We're going to keep it open all of February and March, but the sooner you can do it, the better. Why am I saying this? Because there are discussions right now that are happening. We know that we're in what is called a continuing resolution, and that the new administration and people in government are talking about redoing the federal budget. So those decisions and discussions that are happening right now are really important. And the sooner we can share these tools with our federal delegates and your stories, the sooner they can, share that information during these discussions prior to, a new federal budget being developed and adopted. So please share it, if you can, as early as possible in February, but we'll leave it open through March as well.
Absolutely. I want one last thing on that slide, Jennifer, if you wouldn't mind going back, is that I want to also spotlight that there are other amazing advocacy organizations that are doing this similar work of gathering stories. And that's the Boston Community Independent Living Center, that's the ARC. So whether you're sharing with us or you're sharing with anyone else, the powers that we as a community are building coalitions. So please feel free to use this resource or look for our partners.
Excellent point, Josh. I'm so glad you noted that. Here's some, is this?
Yeah. I think, yeah, I guess this is, these are some of the organizations that Josh just referred to. There's also the Autistic Self-Advocacy Network, and this is the MDDC's parent network, the National Association of Councils on Developmental Disabilities. But I guess I just want to sort of end by thanking everyone for coming from listening to us today. And we're going to stay on for a few minutes to answer questions, and we'll be sending you the slide deck, the recording, and also the story the link to tell your story. And also, as noted in the chat, I have a poll up here. What is this?
Yes, so sorry, I clicked the button too soon,
Oh.
Gyasi. Here's a poll we would appreciate everyone responding to today about the information session. There's only, let's see, 6 questions. Most of them are multiple choice. We'd like to get some feedback about how we can improve the session and what you got out of it today. Sorry to interrupt, Gyasi, and you were saying?
Just that in the chat, actually, there were some other important things mentioned, that the legislative reception on March 6th, and also a rally for PCA services on, I think it was March, I can't remember the date, but someone put in the
March
chat
6th
about.
is the legislative reception, yes.
And when is the rally for PCA services at the State House?
I don't have that date off the top of my head. Maybe Chris.
Yeah, Chris Ho, I think, put it.
Yeah, March 12th.
March 12th. March 12th. Thanks. Okay. Oh, Handra, Chris, what's your question? You have a question?
Well, so last year the governor, so there are Fed things going on in Washington, and then there are things going on with our governor and our legislature. And last year, the governor proposed $100 million cut to the PCA program, which I think would have particularly badly impacted the community of people with developmental disabilities, because they're particularly would have eliminated PCA services for people who received less than 10 hours of hands-on kind of help. Completely eliminated. That would have been 6,000 people. This year we're okay with the budget, but then they are wanting to put a cap on the PCA program that would of 3% increase in costs, and that's with people getting older. People use use PCA services because they get older. There are just going to be so many more people who will need the services. They're going to be looking for ways to cut. And so I think there's an idea that people like me who use a wheelchair and need help with my body need it more than other groups. And we need to hear from every community that uses PCA services. And there are other ways that even before changes coming from Washington, D.C., are that the legislature and the governor are thinking of ways to balance, to save money by not doing what we need. So those stories are so important.
Thank you, Chris.
Thank you, Chris.
Jackson, if you haven't already, can you share in the chat the link to for folks to sign up to our newsletter so they can stay informed and be connected to us as we continue to monitor potential changes in Medicaid, and let folks know how they can help educate lawmakers.
And Jennifer, just to hop in, would it be possible to stop sharing screen? People who are asking questions, we're hoping to get our pictures back.
Sure. I just wanted to share the final
slide
in the slide deck as well. And again, we will email the slide deck link to the video recording from today. We'll also include information about our legislative priority survey, our upcoming bill sharing session on Thursday, the 13th, and our 47th annual legislative reception that takes place on March 6th. These are all ways that you can be more engaged and informed and contact with your state representative or your state senator, sharing concerns like Chris shared just now, letting them know how important providing adequate funding for all people with disabilities, their services, so they can live as independently as possible in the community is really important. And I'll stop sharing. We are going to stay on for another 15 minutes to continue the conversation and answer more questions. I would encourage you, if you haven't already, finish the survey that I launched. I'm going to close that out in just a minute. And stop sharing.
All right, so Fran has had their hand up for a while. So
yeah, let's go there first. Let's allow folks on the council, let's allow self-advocates, family members, and guests to ask questions first.
Okay.
Hi, everyone. I used to actually be a council member. It was really amazing. The one thing I get concerned about when it comes to Medicaid is that the transportation that they offer, because I use transportation